The infectious disease, HIV and AIDS, and the impact that it has on homosexual Latino men in San Francisco, California, by Danielle Curtis, Nicole Raycock, and Roger Connor. Target population. In San Francisco, 1 in every 4 gay and or bisexual men are infected with the HIV and AIDS. Each year in San Francisco, about 86% of the gays and bisexual men within the population are newly diagnosed with HIV. A majority of the Latino, gay, and bisexual men who move to San Francisco have done so because, unlike other cities, they are able to have more sexual freedom and gender expression. Identification through assessment. Through research, we have learned that the most common reasons why gay and bisexual men are being infected with HIV and AIDS is perhaps due to their risky lifestyle behaviors, such as having unprotected anal sex and their use of injectable drugs utilizing unclean needles. Gay and bisexual men feel as though, since they are already infected by the infectious disease, they can continue with their risky behavior when they should be preventing the disease from spreading any further. Those who are infected are affected by the virus in several different ways, such as practicing seroconcordant relationships, such as being with someone else who is also infected with the HIV virus. Another major side effect for those who are infected is the experience of psychological mental behaviors. Population. According to statistics, around 15,900 people were infected with the disease, making California one of the states with the largest HIV populations. After the first diagnosis, nearly half of the infected population refuses the proper care for more than 6 months, which results in the disease to get worse. Of those individuals diagnosed, more than 88% take medication as well as take other steps to keep the disease under control. From 2001 to 2013, gay Latino men suffering from the virus had a life expectancy of about 5 years, which is actually longer than men diagnosed within the African American communities. When a person is diagnosed with HIV and AIDS, other illnesses and disease manifestations can occur, such as cancer and pneumonia. Risk factors. From 2009 to 2013, the Latinos in California alone went from 21% to 25% in regards of HIV and AIDS. San Francisco has a higher number of Latino gay men within the last 15 years with the disease. The Latino population in San Francisco will not only engage in riskier sexual behavior, but their past or current history has a filtering effect on the uprise of HIV and AIDS disease. Gay Latino men in San Francisco are more prevalent within communities of low economic standing. They do not have access to healthcare services and education to combat low income, drug use, alcohol use, and unprotected anal sex. A Spanish prevention intervention called Hormonas de Luna y Sol for Latino gays and bisexual men in San Francisco helps in dealing with the common history of oppression among Latino gay men, including several issues of homophobia, machismo, sexual abuse, racism, and separation from their family and culture. Demographic variables. Demographic variables such as age, socioeconomic statuses, family and community structure, and racial and ethnic composition have been demonstrated to have a direct reflection on the health of a community. Before society can understand how to combat an adverse health outcome of a particular population, we must first understand what drives the health disparity to exist and thrive within the particular community. Within the San Francisco County community, there are an estimated 15,901 members living with the HIV and AIDS, as reported by physicians, laboratory test centers, and local health departments. Men who have sex with other men make up about 65% of the reported HIV and AIDS cases. Latinos make up 15% of the San Francisco population, but account for 34% of HIV and AIDS cases. This is a rate that is 3 times the rate of white people. People between the ages 20 to 29 make up about 19% of the reported HIV and AIDS cases. Although AIDS has shown no prejudices amongst the generalization of communities, HIV and AIDS exist in all levels of socioeconomic levels in society, but studies have shown that those who live within poor communities often suffer from the contraction of the disease at a rate that is significantly disproportionate to those of higher economic statuses. About 13.5% of San Francisco populations live below the poverty level. Some social stigmatisms of those who live alternative lifestyles are associated with the resentment of them to take appropriate measures to prevent and protect themselves from contracting the disease and seek medical treatment as they should. Furthermore, gay Latino men living with HIV face two stigmatisms, both as being a gay and having HIV and AIDS. This may cause a conflict with relationships of family and friends. About 48% of those living with HIV and AIDS do not comply with healthcare plan requirements that are recommended. Cultural competence of Latinos has also aided in the reflection of HIV and AIDS incidence and treatment compliance within their communities. Having different religious and cultural background contributes to Latinos' inability to satisfy cultural expectations of a predominantly white population. Although there are services that aid the Latino population in its combat against HIV and AIDS, research has shown that generally Latinos have demonstrated that some may not fully understand health processes and services that are provided to them within their communities. Assessing the problem. Two services that aid in the assessment of prevalence of HIV and AIDS within the Latino community in San Francisco, California is the Office of AIDS, Center for Infectious Disease, California Department of Public Health, and local health departments. These organizations helps to assess, treat, and review the prevalence and occurrence of HIV and AIDS within communities of the Latino population. HIV infections and AIDS diagnoses are reported through a combination of both passive and active surveillances. Passive surveillances conducted through state requires reporting of HIV and AIDS cases by health care providers, and reporting of HIV positive test results from laboratories to local health departments. Surveillance is also accomplished through hospital visits by local health department staff to hospitals, physician offices, laboratories, counseling and testing centers, and outpatient clinics to ensure completeness, timeliness, and accuracy of reported data. For this reason, local health departments are relied upon heavily to perform active surveillances, on-site chart reviews, and case report completions. Addressing the issue. There have been numerous programs that have been available to men of the Latino race that are living with a homosexual lifestyle, but the Proyecto Solar program seems to be the most effective. The Solar program was developed by a man living with a gay lifestyle and is directed towards gay and Latino men that are living with the HIV and AIDS. This program is set up as a day-long retreat where men are able to channel their personal aspects about present and future relationship as well as HIV prevention. After the men in the program have gone back to their activities in their regular life, they're asked to come back and return to the program exactly 1 month later to share their experiences as well as other information with anyone that has recently joined the group. The HIV and AIDS surveillance program has been utilized by the state of California to show a breakdown of how many people are affected with HIV and AIDS virus each year. The National HIV and AIDS Strategy was designed and put into action so that the amount of infected people would be reduced as well as keeping the infected population from being a victim of stereotype. Research. The community researcher partnerships are programs that have been set up within the state of California so that people are able to better understand how to better address and take care of the things such as social problems and HIV and AIDS prevention. Although institutional influences like the Catholic Church are not in favor of Latino men living a homosexual lifestyle, various programs allow gay Latino men to express their sexuality without feeling confined. The Henry J. Kaiser Family Foundation was founded and set in place because the Latino community has a higher rate of people infected with new and existing HIV and AIDS cases. This foundation allows access to testing as well as prevention and care because the virus within the Latino community has become an unevenly distributed epidemic. Essential services of program development. When it comes to preventing the HIV and AIDS virus from continuously being transmitted, it is important to encourage each and every person to get tested at least once a year, along with making sure that they have access to programs that are within the state of California, such as the SOLAR program. If the Latino men do not feel threatened by discriminatory comments, actions, they will feel better about reaching out to others for engagement, as well as becoming more educated about the virus and how to apply the knowledge to prevent further transmission. When there are programs accessible to people that are experiencing the same things, they're able to connect better as they attend the retreats, discuss obstacles that they have had to endure, as well as milestones that they may have overcome. Since the SOLAR program specializes in retreats, it is much like a mobile community as they meet in different places and various times. Incorporating a mobile unit during the times in which the retreat is held is a great idea because the attendees are able to reach out to others who may know their HIV and AIDS status. Existing policies. In the past, individuals who were infected with the HIV and AIDS had to worry about getting denied insurance because of pre-existing condition. Well, now that is not an issue because of the Affordable Care Act. Also, there is the Ryan White program, which helps patients pay for the services that they need dealing with being infected with the HIV and AIDS. The ADAP program ensures that those who do not have Medicaid and are also infected with the HIV and AIDS still get their medications through this program that is founded by each state. Policy development. Companies should take the time to educate their employees to not discriminate against those who have or could be infected by the HIV and AIDS. Also, in a lot of larger companies, they should start HIV testing, something that is completely voluntary, but at the same time encourages them to take the test and be there for them. With PrEP, this allows for those people who may have been in contact with someone who is infected with HIV the chance to get the virus, to not get the virus. Basically, what this treatment does is an individual would take a dose of the HIV medication, which is known as an antiretroviral, and it would fight the virus so that they would not become infected. Stakeholders and facilitators. This organization has taken part has helped out San Francisco and other cities by being part of such programs and policies as the National HIV and AIDS Strategy and even the annual federal budget process. This is an organization that is actively involved in being there for those in the community who are infected or not sure if they are infected with the HIV and AIDS. The reason for choosing this foundation is because since they have been around, they have reduced the infection dramatically, and they take the time to educate the community about the virus. Another stakeholder and facilitator is Channing Chesley Wayne, who currently works with the Ryan White program as a co-chair member, and she plays an active role in the San Francisco HIV prevention program. The reasoning for choosing her is because she herself is HIV positive, so she is better able to contact and connect with those she is attempting to help on a personal level, and also the fact that she continues to work within the community to help improve it. Thank you, and this concludes our presentation on the infectious disease HIV and AIDS and the impact that it has on homosexual Latino men in San Francisco, California. References are as follows.